study with me. And you can play along. These are hard questions. Okay, guys, it's mental health. We're gonna do some NCLEX style questions, and these are, I always do 10 of them. These are about personality disorders, substance-related disorders, anxiety disorders, and anxiety-related disorders. So what you're gonna do is you're gonna hear me ask the question, and you're gonna see the answers, and you can play along. You can try to figure out the question. I'm gonna be doing it at the same time. So hit pause if you don't wanna hear my thoughts before you make a choice. And if you like these, if there's a different topic you want, NCLEX topic, of course, let me know and we will study together. I have child rearing coming up, labor and delivery coming up, community health coming up, policy, legal, something. I don't know, are there NCLEX questions on that? Ugh, we'll see. All right, but these are personality disorders, mental health ones. All right. Oh, I'll put one in order. I don't like these. These are hard. A client has been diagnosed with avoidant personality disorder. He complains of loneliness, but has fears about making friends. He also reports anxiety about being rejected by others. In designing a long-term treatment plan, in what order from first to last should the nurse include the following? So I'm guessing baby steps. You guys, I love that movie. Do you love that movie? You know what movie that is?
Baby steps.
How does he solve his problems? Here's choice 1. Teach the client anxiety management and social skills. I feel like that should be somewhere early on. 2, ask the client to join one of his chosen activities with the nurse and 2 other clients. Okay, that sounds further down because he hasn't chosen activity. 3, talk with the client about his self-esteem and fears. 4, help the client make a list of small group activities at the center he would find interesting. Okay, right away. 2 is last. 4 is third. I think you listen before you teach. So I'm going to go 3, 1, 4, 2. Because first you listen to the problems, then you teach some skills, then you give some homework, and then you do it. So 3, 1, 4, 2. Let me see if we're right. 3, 1, 4, 2. Yay! Here is the rationale. The client needs a stepwise plan for developing a social life. He needs to first work on his self-esteem and reduce his fears of rejection before talking about how to decrease his anxiety and learning new social skills. Helping him choose interesting activities is important before suggesting an activity for him. Then he will be ready to try a structured activity with the nurse present for support and role modeling. That's good. I'm really surprised how much these mental health nursing questions are putting nurses in a counselor role. I didn't realize that. I mean, my background with school, I took a lot of psychology counseling classes. Human services degree is almost like if you took psychology and social work and crammed them together, it's a little of psychology, a little social work. That's human services, my first degree. I thought mental health nursing would be a lot more just understanding the disorders and giving out the meds, not the counseling part. But I like that. So number 1 was right. Ding, 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 ding. Question 2. A client diagnosed with borderline personality disorder has self-inflicted cuts on her arms. The nurse is assessing the client for risk of suicide. What should the nurse ask the client first? 1, about the medication she has taken recently. 2, if she is taking antidepressants. 3, if she has a suicide plan. 4, why she cut herself. I mean, I'm just going to go straight up with, why'd you cut yourself? But I feel like why is an accusatory plan. Like, how did you cut yourself? I don't know, unless it's obvious that it's cutting. I'm really not positive on this. What should the nurse ask the client first? I feel like if she has a suicide plan, is really, you haven't built any rapport yet if you just start with that. I'm kind of waffling between 1 and 4. Borderline personality disorder. I'm gonna go with 4. I don't know. I'm not feeling too confident, but let's see what it is. I'm just gonna go with, you're assessing suicide risk. Let's ask if she has a plan. Okay. Okay, what did I say? I said I'm gonna go with number 4. She has a suicide. We're assessing suicide risk. We're gonna ask her if she has a plan. Guys, I don't know if this is right or wrong. I don't know what my answer was. I said 4, but then I read number 3's answer. Let's give me half a point for this. I wasn't trying to do that, I promise. The answer is 3. The client is at risk for suicide, and the nurse should determine how serious the client is, including if she has a plan and the means to implement the plan. So while medication history may be important, the nurse should first attempt to determine suicide risk. Asking the client why she cut herself will likely cause the client to respond with insufficient information to determine suicide risk. I really was waffling between 1 and 4 because 3 is really direct, but then I think I finally landed on let's just straight out ask her. Anyways, I don't know if I got that right or wrong. Let's throw that one out. I don't think we can count that one since I said 4 and then said number 4 and then read number 3, but we can be direct. Those are awkward questions and uncomfortable questions, but as nurses, you got to get used to asking awkward and uncomfortable questions because we talk about awkward and uncomfortable stuff. So yes, it's number 3. All right, question number 3. When developing the plan of care for a client diagnosed with personality disorder, the nurse plans to assist the client primarily with which of the following? Okay, they have a personality disorder. 1, specific dysfunctional behaviors. 2, psychopharmacologic compliance. 3, examination of developmental conflicts. Or 4, manipulation of the environment. What does the nurse plan to assist the client with? Again, I thought nursing was more just about the meds. They're doing a lot of counseling stuff. I feel like more the counselor would discuss the specific dysfunctional behaviors, but if you're developing a plan of care, I think it's 1 or 2. I'm going to go with 2 because 1 seems more important. Well, I mean, 2 is really important. I feel like nurses help people take meds. I'm going with number 2. I'm not confident. Psychopharmacologic compliance. That's the primary thing to help them with. 3. Womp, womp, womp. I should be doing what I thought the counselor should do. Number 1 is the answer. The nurse should plan to assist the client who has a personality disorder primarily with specific dysfunctional behaviors that are distressing to the client and others. The client with a personality disorder has lifelong, inflexible, and dysfunctional patterns of relating and behaving. Sorry, I'm not looking at you, I'm reading. The client commonly does not view his behavior as distressful to himself. The client becomes distressed because of others' reactions and behaviors towards him, which cause the client emotional pain and discomfort. Psychopharmacological compliance is not a primary need because medication does not cure a personality disorder. Interesting. Medication is prescribed if the client has a severe symptom that interferes with functioning, such as severe anxiety or depression, or if the client has an Axis 1 disorder. Examination of developmental conflicts usually is not helpful because of the ingrained dysfunctional ways of thinking and behaving. It is more useful to help the client with changing dysfunctional behaviors. Although milieu management is a component of care, the client is usually proficient in manipulation of the environment to meet his needs. So, yeah, personality disorder, meds really aren't a big help, and they're already good at manipulating the environment, and specific dysfunctional behaviors, helping them with that is way more practical than examination of the developmental conflicts. So, not doing so hot today, guys. Let's see if number 4 goes better. Number 4, a client diagnosed with paranoid personality disorder is hospitalized for physically threatening his wife because he suspects her of having an affair with a coworker. Which of the following approaches should the nurse employ with this client? Okay, they're paranoid. Should you be authoritarian, parental, matter of fact or controlling? I'm going to go with matter of fact because they're paranoid. And matter of fact seems the most calming. That seems the most calming. Let's see if number 4, 3, yes, I got one right, guys. Matter of fact, for this client, the nurse needs to use a calm, matter of fact approach to create a non-threatening and secure environment because the client is experiencing problems with suspiciousness and increase his trust in the staff and the environment. An authoritarian approach is non-therapeutic and inappropriate because this client may perceive this approach as an attack, subsequently responding with anger and threatening behavior. A parental or controlling approach may be perceived as authoritarian and the client may become defensive and angry. So, all right, 5, guys. That one was much easier. 5, we're going to talk about schizo. I have not read this word. Schizotypal. When planning care for a client diagnosed with schizotypal personality disorder, which of the following helps the client become involved with others? What helps the client become involved with others? Would it be participating solely in group activities, like only in group activities? 2, being involved with primarily one-to-one activities? 3, leading a sing-along in the afternoon? Or 4, attending an activity with the nurse? I'm going to say it's either 1 or 2. I feel like a one-to-one activity could be more stressful than a large group. So, if I'm assigned one person to interact with, to do something with, what if I don't get along with them? But if there's a whole group, it'd be easier to blend in if I want to, or to find one person I'm comfortable with. So I'm going to say that we're going to help them participate in solely group activities. That's number 1. Totally wrong, guys. It is 4, attending an activity with the nurse. Honestly, I just thought that seemed a little one-on-one, a little more one-on-one than nurses could do. Attending an activity with the nurse assists the client to become involved with others slowly. The client with schizotypal personality disorder needs support, kindness, and gentle suggestions to improve social skills and interpersonal relationships. The client commonly has problems in thinking, perceiving, and communicating and appears similar to clients with schizophrenia, except, and I don't know this part, so let's learn it. How's schizotypo? I don't even know if I'm saying that right. Different? The psychotic episodes are infrequent and less severe with schizotypo. Participating solely in group activities or leading a sing-along would be too overwhelming for the client, subsequently increasing the client's anxiety and withdrawal. Engaging primarily in one-on-one activities would not be helpful because of the client's difficulty with social skills and interpersonal relationships. However, activities with the nurse could be used to establish trust. Then the client could proceed to activities with others. I think I would enjoy participating in activity with them. Like I said, I really did not realize how hands-on mental health nursing could be. I like it. Number 6. A client is complaining to other clients about not being allowed by staff to keep food in her room. I mean, I would be annoyed at that. The nurse should 1. Ignore the client's behavior. 2. Set limits on the behavior. 3. Reprimand the client. 4. Allow the snack to be kept in her room. Obviously, there's probably a rule, some sort of regulation rule or something, why this person can't have snacks in the room. So letting them have a snack is not supposed to be the right answer. Reprimanding the client, I think you should be allowed freedom of speech to complain. So I don't think that's right. Set limits on the behavior or ignore the client's behavior. I feel like I would just ignore it. I mean, they have freedom of speech. They can complain about it. It's the rule. If they want to complain about it, that's their right. It's not helping anything. I might try to reason with them if I thought it was possible, but set limits on the behavior. The behavior is complaining to people. I don't know. I'm going to go with ignore it. So, question number 6. I should not have ignored it. Guys, this is not my day. I don't know what the score is, but it's not good. The nurse needs to set limits on the client's manipulative behavior to help the client control dysfunctional behavior. The manipulative client bends rules to have his or her needs met without regard for rules or the needs or rights of others. A consistent approach by the staff is necessary to decrease manipulation. Ignoring the client's behavior reinforces or promotes the continuation of the client's manipulative behavior. I don't know if it always would. I mean, they're getting in a pattern of, I guess. I mean, what do I know? I'm the student. This is an expert book. I shouldn't argue with it. Reprimanding the client may be perceived as a threat, resulting in aggressive behavior. Allowing the client to keep a snack in her room reinforces the dysfunctional behavior. So I did narrow it down between two and had the right answer in those two, but womp, womp, womp. Question 7. A client with an Axis 2 diagnosis of antisocial personality disorder has a potential for violence and aggressive behavior. Which of the following client outcomes to be accomplished in the short term is most appropriate for the nurse to include in the plan of care? Is it use humor when expressing anger? Oh, I think that would make them more mad. Discuss feelings of anger with staff? I feel like that's a good thing. Ask the nurse for medication when upset. It's not totally bad, a PRN med, but use indirect behaviors to express anger. I'm going to say that the plan of care would be discuss feelings of anger with staff. Like, first you talk about the feelings, and then maybe the staff decides, to suggest a PRN med or to offer it. But first you would talk about it. We're going to see if 7 is number 2. Come on. Yes! Right. The nurse assists the client with identifying and putting feelings into words during one-to-one interactions. This helps the client express her feelings in a non-threatening setting and avoid directing anger towards other clients. The client with an antisocial personality disorder needs to understand how others feel and react to her behaviors and why they react the way they do. The client also needs to understand the consequences of her behaviors. Using humor or indirect behaviors to express anger is a passive-aggressive method that will not help the client learn how to express her anger appropriately. Asking the nurse for medication when upset is a way to avoid dealing with feelings and is not helpful. However, medication may be necessary if talking and engaging in the physical activity have not been effective in lowering anxiety or if the client is about to lose control of her behavior. I feel like we were spot on with that one. Woohoo! All right, guys. 3 more. You can do this. Stay with me. A client was admitted after making a suicidal gesture in a police car. He is diagnosed with antisocial personality disorder and has been stealing equipment from his work. He states, "It's not a big deal. My boss can afford a few missing pieces. He picks on me anyway." Which of the following is the most appropriate response by the nurse? 1. Have the police charged you with the thefts? 2. Stealing is a crime regardless of the reason. 3. I bet your boss doesn't think he can afford the losses. 4. Are you having any guilt feelings at all? Okay. Antisocial personality disorder. He made a suicidal gesture, but then he's like, it's not a big deal. My boss can afford a few missing pieces. He picks on me anyways. I don't know, guys. I don't even know. I don't think you'd ask if he has feelings of guilt. Sounds like he doesn't. I don't think you ask if the police has charged you with theft. I'm going to say you say, I bet your boss doesn't think he can afford the losses. I don't think it's right. I really don't know. 2 would be very matter-of-factly stating something for him. Stealing is a crime regardless of the reason. 2 or 3, but I'm going to go with 3, but I'm not very confident. It is 4. Are you having any guilt feelings at all? Let's see. The client diagnosed with antisocial personality disorder is manifesting behavior indicative of problems in Erickson's stage of initiative versus guilt. Typical behaviors of a client with antisocial personality disorder are engaging in illegal activities, violating rights of others, lack of guilt or remorse, recklessness, and impulsiveness. Aggressive behavior and irresponsibility in work and with finances. The nurse should determine if the client is feeling any guilt. A lack of guilt or remorse for offenses such as stealing is typically present. That's what I thought. Like, we already know he doesn't feel guilty because of what he said. But let's see. As if the client does not have a conscience. Behaviors indicating problems in the stage of trust versus mistrust include suspiciousness, projection of blame and feelings, and withdrawal. Behaviors indicating problems in the stage of autonomy versus shame and doubt include self-doubt and self-consciousness, dependency on others for approval, and denial of problems. Behaviors indicating the stage of industry versus inferiority include poor work history, inadequate problem-solving skills, and manipulation of others. These are hard questions. I still don't completely understand why are you feeling any guilt was the right question. Because it sounds like he wasn't. I don't know. I read it to you. It is what it is, guys. I'm not the expert, obviously. 2 more questions. That's the hard ones. Which of the following approaches should the nurse expect to include in the plan of care for a client diagnosed with so many antisocial personality disorder questions? Okay. Antisocial personality disorder who has a history of stealing and jail time. Okay, what's the plan of care? We already know we were going to ask him, did you feel any guilt? Helping the client develop a conscience, teaching the client consequences of her actions, assisting the client with understanding right from wrong, using strategies to help the client become passive. Passive instead of aggressive? I'm going to say, these are so hard. I mean, they need to develop a conscience. I don't know. 1, helping the client develop a conscience. I don't have good rationales, guys. My brain's turned into mush on this. I think it's 1. It's not a very measurable care plan goal. Teaching the client consequences of her actions is more measurable. I would think they do know right from wrong. They just don't care. I'm gonna go with 1. I don't know why even. I don't know, guys. It's wrong. It's supposed to be the nurse should teach the client consequences of her actions to help the client understand that if she steals, she will get into legal trouble and be put in jail. So if she wants to avoid jail, she needs to not steal. Helping the client to develop a conscience or to understand right from wrong is impossible. I don't think it's impossible. Just highly improbable. However, the client needs to be taught that her actions do lead to consequences. Using strategies to help the client become passive is not helpful, is non-therapeutic, and does not help the client to understand consequences of her actions. Okay, 1 more. A 28-year-old client with Axis 1 diagnosis of major depression and Axis 2 diagnosis of dependent personality disorder has been living at home with very supportive parents. Does that mean enabling? The client is thinking about independent living on the recommendation of the treatment team. The client states to the nurse, I don't know if I can make it in an apartment without my parents. The nurse should respond by saying to the client, 1, you're a 28-year-old adult now, not a child who needs to be cared for. Probably not helpful. 2, your parents won't be around forever. After all, they're getting older. Probably not helpful. 3, your parents need a break, and you need a break from them. 4, your parents have been supportive and will continue to be even if you live apart. I feel like 4 sounds like the most appropriate. Yay! Number 4. Some characteristics of a client with dependent personality are an inability to make daily decisions without advice and reassurance, and the preoccupation with fear of being alone to care for oneself. The client needs others to be responsible for important areas of his life. The nurse should respond, your parents have been supportive of you and will continue to be supportive even if you live apart, to gently challenge the client's fears and suggest that they may be unwarranted. And that tells you why the others are wrong. Thanks, guys. Thanks for listening with me. That was all 10. I don't know my score. I will see you next time. Bye-bye.